Common transdermal estrogens include 17-beta estradiol in a gel form called estrogel or in a patch form called estradot. One canister of estrogel contains 60 pumps of gel. Other estrogen gel products like Divigel come in disposable packets containing an individual dose. These products are used daily and usually applied the last thing before going to sleep. Gel should be spread in a thin layer over the surface of your outer arm from the shoulder down or inner thigh. Do not apply on or near your breasts or genital areas. If you're using 2 pumps, apply 1 pump to one area and then the other pump to the other area. For example, 1 pump on your left arm and 1 on your right. Allow the gel to dry for about 5 minutes before covering the skin with clothing. For the next hour, do not wash or apply any other skincare product to the skin or have contact with another person. Wash your hands with soap and water after application so that you don't get the gel on other people or surfaces. Ideally, it's best to apply the gel to clean, dry skin. The Estradot patch is a common patch prescribed in our clinic. It is slightly larger than a postage stamp, and it is used 2 times per week. It should be removed and replaced with a new patch with each change. Each box has 8 patches, so 1 box will last you 4 weeks. Most individuals wear it on their lower abdomen or their upper buttock and alternate the side of their body that they apply it to avoid skin irritation. The package insert contains a map of a female body highlighting areas where the patch could be applied. You should avoid placing the patch on your breasts or genital area. Ideally, it should be placed on skin overlying an area of fat, as the fat acts as a reservoir for hormone. For example, most individuals should avoid their wrist, their rib cage, or their hip joint for best absorption. It can be worn while sweating, swimming, and bathing. Issues with adherence are quite uncommon. If you have difficulty removing the patch or any residue left behind, apply a small amount of oil to help release it. Ensure that you are applying your new patch to clean, dry skin. Individuals who experience skin irritation from either product should discuss a change in medication with their doctor. Common oral estrogens include conjugated equine estrogen, the brand name being Premarin, and estradiol, the brand name is Estrace. These tablets should be taken once per day. Discuss the time of day with your pharmacist, as other medications you're taking may impact the absorption of one or both medications. For example, it's best to avoid taking estrogen at the same time as thyroid medication. Estrogen can cause nausea, breast tenderness, and headaches in the first few weeks it's introduced. If these symptoms continue, your dose may feel too high for you. Progesterone is used in individuals who have a uterus. It is typically used to protect the uterine lining from cancer or precancer. There are various progesterone options available in Canada. These include 2 tablets. The first is micronized progesterone, the brand name is Prometrium, and medroxyprogesterone acetate, the brand name being Provera. Both can be taken orally. Prometrium can also be absorbed if inserted into the vagina. A levonorgestrel IUD, the brand name being Mirena, is potentially an option that may be discussed by your doctor. It's not as rigorously studied as the progesterone component of an MHT regimen compared to the other products. However, it delivers progesterone directly to the uterus, meaning that less is absorbed into the bloodstream and delivered to the breast tissue. Progesterone tablets may make you feel tired or dizzy and are best taken before bed. When it comes to tablets, there are 2 different ways you can take progesterone. One is continuously, which means that you take a dose every night. With this regimen, you should not expect bleeding, and you should call your doctor if you develop any bleeding. The other way is to take progesterone for 10 to 14 days of the month, depending on the instructions from your doctor. For simplicity, I find it's best to start taking these on the 1st of the month. For example, January 1st to the 12th, February 1st to the 12th. With this regimen, you provide your uterine lining a chance to shed. This may be the best method to choose for women who have not had 1 year without periods. You may bleed for several days toward the end of taking your pills or within a week after you stop them. Do not worry if you do not get a period. Take notes on your bleeding pattern and discuss it with your doctor. Make sure to seek more urgent care if you develop prolonged or heavy bleeding, especially if you start to feel faint. Progesterone tablets tend to replicate the PMS symptoms you had when you were regularly cycling. These include breast tenderness, mood changes, bloating, and constipation. If these symptoms are bothersome for you, consider discussing your dose and the type of progesterone you're taking with your doctor. Combination products also exist. In a patch form, Astellas provides estrogen and progesterone replacement, and it is changed twice per week. However, progesterone absorption through the skin has not been as thoroughly tested as other forms of progesterone replacement. In oral tablet form, many products can provide both estrogen and progesterone together. One such product is Activel. It is a single tablet taken daily. With these products, no bleeding is expected, and you should call your doctor if you experience any bleeding. Other combined pills are mainly marketed as birth control pills. A low-dose birth control pill may feel like a more practical choice for you. It also may work well to thin down the lining of the uterus and reduce the chance of abnormal bleeding. This is especially helpful for women who have not yet had 1 year without bleeding. Tibolone is a hormone that acts on estrogen, progesterone, and testosterone receptors. It is a tablet taken once daily. It has been available in Canada since the summer of 2020, but it was created in 1988. It may result in less unpredicted bleeding and an improvement in sexual function. It has been shown to have the same benefit to bone density as other oral hormones. While currently recalled and not available in Canada as of June 2022, there is one last systemic MHT option. This is the tissue-selective estrogen complex known as Duaviv, which is made up of 0.45 milligrams of conjugated equine estradiol and the selective estrogen receptor modulator, basodoxifene. Duaviv is taken once per day. It is only available in one oral dose. As such, it may be difficult to fit into your needs. However, it has been shown to reduce abnormal bleeding and breast symptoms compared to other forms of MHT. It appears to be equally helpful for bone density. Systemic MHT is not right for everyone. Here's a list of contraindications and conditions where you may not want to take hormone therapy. Talk to your doctor about whether it's right for you. How long does it take for systemic MHT to work? You will experience the maximum effect of your MHT after 12 weeks. But for those with very severe symptoms, you may experience some relief within the first week of use. Doctors tend to review and make adjustments to hormone therapy regimens after 12 weeks. When lowering your dose of hormone therapy, you likely will not feel the full impact of the decrease until 8 weeks later. What are the risks of systemic hormone therapy? Risks vary depending on your past medical history and your family history. Estrogen therapy slightly increases the risk of venous thromboembolism and stroke or a blood clot. But this should be weighed against the favorable impact on your bone density and your quality of life. When taken in combination with progesterone for 5 or more years, there's also an increased risk of breast cancer. This is an extra 1 case of breast cancer in 1,000 women taking MHT. MHT does not increase cardiovascular risk in appropriate selected women who are starting hormone therapy at less than age 60 and less than 10 years from menopause. Your doctor will speak to you about the risks that may be particularly significant for you. There is no known increase in the risk of breast cancer for those who have had a hysterectomy and are on estrogen alone, or for young women who are taking hormone therapy due to a history of premature or early menopause. The product called Duaviv appears to be less active on breast tissue, but given its recent release, it has not yet been demonstrated to reduce the long-term risk of breast cancer. Always ensure that your mammograms are up to date by checking in with your primary care physician. The best time to start MHT is before age 60 and less than 10 years since the final menstrual period. but there is no universal right time to stop. The length of time that menopause symptoms last varies for each individual. Menopause hormone therapy helps to mask these symptoms, but it doesn't change what your body is meant to do. North American menopause practitioners advocate that treatment should be individualized and each person should be on the lowest effective dose to control their symptoms for the shortest amount of time. By slowly lowering your dose of MHT, you'll likely learn more information about the minimum effective dose for you. By going slowly, you can also minimize the interference with your quality of life. It is less advisable to completely discontinue and then restart MHT for extended periods of time, as your highest risk of a blood clot is in the first 3 to 6 months of use. Low-risk, symptomatic women can often benefit greatly from short-term use of low-dose hormone therapy. Talk to your doctor about how they can best support you through this stage of your life.